Welcome to today's explainer. Look, if you're joining us, you're probably looking for clear, actionable ways to really maximize your resources in retirement. Well, today we are exploring something absolutely vital. We're looking at 7 essential, truly life-changing government benefits designed specifically for American seniors. We're talking about billions of dollars set aside to help pay for your medications, your groceries, your utility bills, and even your Medicare premiums. And the best part? We're going to break it all down visually, step by step.
Here's how we're going to break it all down today. First, we'll look at the unclaimed billions problem, then slashing your medical costs, followed by relief for everyday expenses. After that, free care and counsel, and finally, how to actually claim what you deserve. Let's get right into it. Section 1. The unclaimed billions problem, why millions are left on the table. So, think about this for a second. What if the government had billions of dollars set aside? Literally just for you. I mean, money sitting there right now with your name on it. The crazy thing is, most seniors never claim a single dollar of it. And it's not because they don't need the help, and it's definitely not because they don't qualify. It's simply because, well, nobody ever told them these programs even existed. And here is the really shocking truth of it all. Over 40% of eligible seniors leave these benefits completely unclaimed. It's kind of like having a winning lottery ticket just tucked away in a junk drawer and forgetting about it. We're talking about millions of Americans leaving thousands of dollars on the table every single year. Our whole goal with this explainer is to make absolutely sure you are no longer part of that 40%. All right, moving on to Section 2, slashing your medical costs, keeping your health expenses in check. Now, our very first benefit offers some seriously incredible value. It's called the Extra Help Program, or you might hear it called the Low Income Subsidy. If you're on a limited income, this program literally steps in and pays most, or honestly sometimes all, of your Medicare Part D drug costs. It practically wipes out your yearly deductibles and can drop your copays to as little as $0 to $4 a prescription. To put that into perspective, in 2026, this program is worth up to $5,900 a year. That's nearly $500 a month in savings just on your meds. Let's actually ground this in reality for a second. Meet Margaret. She's 72, lives alone on Social Security, and, like so many seniors, she was getting absolutely crushed by her pharmacy bills. She was paying $380 entirely out of her own pocket every single month just to get her medications. But check this out. After applying for the Extra Help program, Margaret's monthly cost absolutely plummeted to just $11 a month. For the exact same drugs. That is a savings of $369 a month. That's over $4,400 a year, coming from just one single program. It's a real game changer. Which brings us to Benefit 2, Medicare Savings Programs, or MSPs. So while Extra Help covers your prescriptions, MSPs actually cover your Medicare costs themselves. The most common level, the QMB program, completely eliminates your Medicare Part B premium. And in 2026, that's $185 a month. It also covers deductibles and copayments. But just by knocking out that monthly premium alone, you are putting $2,220 a year straight back into your own pocket. Now, obviously, knowing exactly where you stand here is absolutely crucial. For the Extra Help program, a single person can make up to roughly $22,590 a year, and a married couple can make up to $30,660. For the Medicare savings programs, they base the limits on monthly income, so that's around $1,255 for a single person and $1,704 for a married couple. There are some really generous asset limits too, but listen, if your income falls anywhere near these numbers, you really need to be looking into these programs immediately. Let's jump into Section 3, relief for everyday expenses, groceries, utilities, and fresh food. All right, Benefit 3 is SNAP food benefits. A lot of folks know this as food stamps, but SNAP is super widely misunderstood by seniors. Actually, only about 42% of eligible seniors even use it. That means more than half of you who qualify are paying completely out of pocket for food when you are legally entitled to get some help. In 2026, the average SNAP benefit for a senior household can be up to $2,160 a year for groceries. Guys, that is literally free money for the supermarket. So here are the specifics on that. You're looking at an average of $120 to $180 a month strictly for food. For a single senior, the income limit generally goes up to $1,580 a month, with resources needing to be under $4,500. It's actually really easy to apply. Just hop onto benefits.gov or call 1-800-221-5689. Seriously, stop paying full price for your groceries if you qualify for this.
Next up, we've got benefit 4. This is LIHEAP, or the Low Income Home Energy Assistance Program. This program is literally built for that stomach-dropping moment when you open a massive utility bill right in the dead of winter or during the peak of a summer heat wave. A lot of seniors receive up to $1,000 a year just to help with their energy costs. And you know what's so fantastic about LIHEAP? It's the coverage. It pays for winter heating, summer cooling, emergency energy assistance, and get this, sometimes even weatherizing your home to prevent drafts. Meaning they will literally help pay to keep the cold air outside where it belongs. If your income is at or below 150% of the federal poverty level, you qualify. And here's a crucial detail. Seniors over 60 get priority access to these funds. Just visit liheap.org to get started. Sticking with the theme of food benefits for a second, let's look at Benefit 5, the Senior Farmers Market Nutrition Program, or SFMNP. This one is such a delightful surprise for a lot of folks. If you're 60 or older and you meet the income guidelines, this program straight up gives you $20 to $50 a season in free coupons. You can use them to buy fresh fruits, vegetables, herbs, and even local honey directly from community farmers markets and roadside stands. I know it might sound kind of small, but it's free, high-quality local food. And when you're on a fixed income, every single dollar counts, right? Okay, let's shift gears to Section 4, Free Care and Counsel, Unbiased Advice and At-Home Care. Benefit 6 is truly remarkable. It's called the PACE program. That stands for the Program of All-Inclusive Care for the Elderly. Picture this scenario. You or a loved one needs the level of care that a nursing home provides, but you desperately want to stay in your own home. Well, PACE actually makes that a reality. It coordinates doctor visits, prescription drugs, physical therapy, personal care at home, meals, and even transportation. And if you're 55 or older and live in a PACE service area, it very often comes at little to absolutely no cost to you. To really wrap your head around the value here, take a look at this staggering number. $9,733. That is the average monthly cost of nursing home care in America. Insane, right? PACE provides that exact same level of care, completely replacing that terrifying potential cost, all while allowing you the dignity and comfort of staying right there in your own living room. It's just an incredible safety net. And finally, Benefit 7 is SHIP, the State Health Insurance Assistance Program. Now, while this isn't a direct cash payout, it could honestly save you more money than anything else we've talked about today. SHIP provides completely free, one-on-one Medicare counseling from trained experts. Studies actually show that seniors who use a SHIP counselor save an average of $1,200 a year. And the absolute best part? There is zero sales pitch, no insurance agent trying to upsell you on something you don't need. These are just unbiased, volunteer experts. I mean, just think about the massive administrative headaches these counselors can solve for you. They'll help you compare Medicare Advantage plans, they'll comb through your current plan looking for hidden savings, they'll even help you appeal denied Medicare decisions. Plus, they are the exact people who can hold your hand and help you apply for those extra help and Medicare savings programs we talked about earlier. They untangle all that red tape completely free of charge. All right, bringing us home with Section 5. Claim what you deserve, taking the next step. Okay, so here is your realistic, totally manageable action plan. Step 1, pick just one benefit from this entire explainer. Seriously, don't try to tackle all 7 today. You'll just get overwhelmed. Just pick the one that would make the absolute biggest difference in your life right now. Step 2, make one phone call or visit one website this week. Take one single simple step. And step 3, claim your money. Because I really want to leave you with this final thought today. You have worked hard your entire life. You've paid into this system for decades through your taxes and your labor. These benefits, they exist entirely because of you. Isn't it time you finally let the system pay you back? You deserve every single dollar of help that's available to you. Thanks so much for joining this Explainer Focus, learners. Go ahead, take that first step today and claim the wealth you have absolutely earned. Catch you next time.